today alongside my colleague Alicia and a panel of experts and champions that we will meet later in our presentation. Today's discussion between expert and champion will focus on places and how the places we live, work, and play in can be built or modified to encourage healthy behaviors. Before we get started, I would like to start with a land acknowledgement. So the Alberta Recreation and Parks Association has worked with two Blackfoot elders, Dr. Reg and Rose Crochue, to come up with a land acknowledgement. As today we'll be focusing on connecting and learning from one another, I'll begin this session with a land acknowledgement that highlights our shared connection through this land. ARPA would like to acknowledge the First Nation, the Métis, and all of the people across Alberta who share a history and a deep connection with this land. We dedicate ourselves to moving forward in partnership with Indigenous communities and in spirit of reconciliation and collaboration. I would also like to recognize the land that I'm currently living, working, and playing on, which is the traditional territories of the Blackfoot Confederacy and the Métis Nation Region 3. And I'm currently on Treaty 7 region of Southern Alberta. So that is where I am saying hi to you all from today. Thank you again all for joining me. And with that, let's go over the plan for today. In today's session, I'll introduce you to our amazing experts and Communities Choose Well champion. Then I will cover a little bit of background to give us all a common vocabulary when we talk about the work that we are doing with places. And then we'll dive into a short overview from our expert and Communities Choose Well champion of some of the amazing initiatives that they're doing in their communities and what they've been up to. And lastly, we'll spend the majority of our session talking with our panel in an interactive roundtable discussion and Q&A format on their experiences and best advice moving forward. Throughout the discussion, I encourage everyone to ask questions in our chat box. This webinar is meant to be as interactive and we are welcoming of all questions. So please feel free to pop them into our chat box. Okay, and with that, let's jump into meeting our experts and our champion. I'm really excited to introduce to you our Communities Choose Well champion, Bonnie Ellis. Bonnie can give a little wave to everyone. She's won multiple Communities Choose Well awards, including our most recent award. So congrats on that, Bonnie. Bonnie attended Lethbridge Community College and obtained her Recreation Facility Management certificate from Red Deer College. Currently, she wears many hats. She is the Community Service Manager of the Town of Vulcan, and with multiple changes over the year within the department, she has a lot of diversity within her role. She's responsible for the Recreation, Community Services, and Tourism departments in her town. Outside of work, outside of work, she is the Community Services Manager. Outside of work, family is very important to her, and living in Vulcan has allowed herself and her husband the ability to live within driving distance to their 4 grown children and families. She's involved with the church, loves reading, running, and vacationing in warm places with her husband, as I'm sure we all do, and seeing what other countries are like. She's an avid volunteer around Vulcan and has served as the chair of the Southern Alberta Summer Games Committee. Her community has received 2 Choose Well awards, and in the 2021 pandemic, the Recreation Department of Vulcan teamed up with other groups to continue keeping their community active, which led to them being named the 2021 Participactions Most Active Community in Alberta. So holy smokes, Bonnie, welcome. That bio is such a testament to the amazing work that you're doing in your community, and we're really excited to have you here today. Okay, we have another very impressive bio here from our expert, Dr. Karen Lee. So I'm excited to introduce to you Dr. Karen Lee. She is an associate professor in the Division of Preventative Medicine, Department of Medicine at the University of Alberta. She directs the Housing for Health project funded by the Public Health Agency of Canada. She is also adjunct professor with the School of Public Health and a medical officer of health with Alberta Health Services. She teaches for the University of Alberta School of Urban and Regional Planning and Columbia University's Mailman School of Public Health in New York City. Dr. Lee is a renowned expert in creating fit cities and served as NYC's inaugural Healthy Built Environment and Active Design Director and Deputy to the Assistant Commissioner for Chronic Disease Prevention and Control. Whew. And she has worked for the Epidemic Intelligence Service at the U.S. Centers for Disease and Control Prevention in the Division of Nutrition, Physical Activity, and Obesity. Her work to create active cities, a guide for city leaders, helped to inspire Edmonton's Live Active strategy. She was a recipient of the 2017 Canadian Institute of Planners President's Award. She's author of the recent book, Fit Cities. For more resources, you can see her website, and we'll link those websites in the chat box for later. So again, some amazing work that Dr. Lee is involved in, and super excited to have you here today, Dr. Lee. And I also want to introduce Shanique Killingback. Shanique is passionate about public health and improving people's quality of life through changes to healthy environments and access to safe and healthy food. Shanique manages and engages the Housing for Health Partnerships Working Group and its subcommittees. And she has an undergraduate degree in environmental health with over 7 years experience as a public health inspector and Masters of Public Health from the University of Alberta. So welcome everybody. I'm super excited, like I said, to have you here today. I'll move on because I feel like I'm talking a lot and we're excited to get to you all. So before we jump into the mini presentations from them, I just want to go over what places means, just so we have some common vocabulary among us all. So Communities Choose Well is working on a framework, and that framework is aimed to support healthy eating and active living initiatives at a community level. So our goal with the framework is to have key areas for our champions to focus on that will have the biggest impact on healthy living. So that's basically what this webinar is for, is to identify one of those main key areas, which is places, and have a webinar focused on that. When we're talking about places, it's important to know that places are tools that communities can invest in to help encourage and support healthy behaviors. And they refer to natural and built environments around us. They can exist in the form of parks, open spaces, community centers, etc. And they can also vary among rural and urban communities. Also, when creating spaces, it's important to consider how these places impact equity, whether that be new or existing, indoor or outdoor. Community places can be designed equitably to ensure all community members have access to them and heal opportunities that they provide, which both Bonnie and Dr. Lee do in their work.
Oh, shoot.
Okay, so now for a presentation from Dr. Karen Lee, so you can stop hearing me speak so much. So I'll hand it over to Dr. Lee to give us a little presentation on what she's been doing in her work.
Thank you, Madison. Thank you to Madison and Alicia for inviting us at Housing for Health to share this presentation. Can everyone see the slides?
Yes.
Okay, I'm trying to. All right, I want to thank Shanique for helping me prep this presentation and also for all her work with our team. So today, we're gonna thank you for the invitation, and we're really looking forward to the discussion with Bonnie and with the audience after this. So we're just gonna talk a little bit today about improving housing and community environments for health. There are some links to various websites, including our Housing for Health website, and my website collates a lot of the materials that I was doing in the past before coming back to Alberta. So I hail from the Edmonton area. I grew up here, but basically I moved away to the US and was there for about a decade and a half, first working for US Centers for Disease Control, US CDC down in Atlanta, and then up in New York City for 12 years, where for the bulk of it, I was working under Mayor Bloomberg's administration for the New York City Health Department. And so just wanted to share, I'll go through and share both the evidence for improving our environments and how that can impact health, particularly healthy living. And then just show a few examples of things that have been done in communities of various sizes, both in the United States and Canada. And then we'll end with just what we're doing now in Housing for Health, and also invite everyone here to actually join us in Housing for Health, in the Housing for Health initiatives. So with that, I'm just gonna start. I think many folks here probably know this, but in Canada, we are experiencing increasing levels of chronic diseases. Based on data from the Public Health Agency of Canada, 44% of Canadians, so nearly half of Canadians aged 20 years and over, have at least one of 10 chronic conditions. And the common chronic conditions include high blood pressure or hypertension, diseases of the joint, osteoarthritis, which can function as a result of wear and tear, of aging, but also of risk factors like obesity, mood and anxiety disorders. So mental health issues are increasingly important as well. Osteoporosis, diabetes, asthma, COPD or lung disease, chronic obstructive lung disease, ischemic heart disease, cancers, and dementia. And, it's not just in Canada that we're experiencing this actually, but the entire world has functionally transitioned from a state where I know we're living in the times of COVID, but, chronic diseases, non-communicable diseases like heart disease, strokes, cancers, diabetes, lung disease have now overtaken infectious diseases as the leading cause of death. And they are now the #1 cause of death, even in developing countries, with over 41 million deaths, or over 70% of deaths yearly occurring from chronic diseases. And the leading risk factors accounting for a large percentage of these deaths are largely preventable: tobacco, inactivity, unhealthy diets, harmful use of alcohol, high blood pressure, overweight and obesity, high cholesterol, and cancer-associated infections. Now, the reason I have physical inactivity, unhealthy diets, and high blood pressure, high cholesterol, overweight, and obesity highlighted in red is because, in the developed world, like Canada, many of our communities, we have done much in the last couple of decades around tobacco. So, we have smoke-free bylaws, we've got, quit lines, we've got a lot of policies. Now, that doesn't mean there's still not work done on certain high-risk populations, but in the general population, we've done actually pretty well at bringing down smoking and at addressing policies that we could do to create healthier environments that are more supportive of both tobacco cessation and not starting smoking in the first place. Similarly, for alcohol, we often have regulations around where it could be sold, who it could be sold to. And so I'm highlighting physical inactivity, unhealthy diets, and then the risk conditions linked to inactivity and unhealthy diets, because I think there's a lot more that we could do around improving our environments to remove barriers to these healthy behaviors and to improve opportunities for them. And so today, we're going to be talking about some of that. The other thing I wanted to mention about chronic diseases is, because we have such high underlying burdens of chronic disease, they ultimately also impact our ability to control and address, infectious diseases. So whether that's yearly flu epidemics that we experience even now, annual influenza outbreaks, we know that, for example, flu is more severe in people who have underlying chronic conditions. And then also emerging infectious diseases like, for example, COVID. The high rates of obesity and chronic diseases like diabetes, cardiovascular disease that are experienced in our populations have implications for severity of illness in our populations from these infectious diseases, both emerging and endemic ones like the flu, and emerging ones like COVID. So, you know, in this age of chronic disease, it actually is very important that we address these underlying conditions. Otherwise, infectious disease conditions are also impacted in terms of severity and mortality rates. The other thing that is also very important is that, you know, 1 in 5 Albertans, just like the rest of the world, is aging. And it's estimated by 2031, 20% of Alberta's population will be seniors. And so there are issues related to aging in place, healthy aging, that we can also address if we improve our community environments for active living and healthy eating. Social isolation and lack of social support as well is another factor that I wanted to highlight. So, you know, I think we often think of social factors like social isolation and lack of support socially as being important for mental health, which it is, and studies show that. But I think less often do we think about how important social factors are also to physical health issues. So there are studies that show that if you are socially isolated, you will do more poorly for chronic diseases like diabetes, high blood pressure, arthritis, emphysema. And there are even studies that show that lower social involvement can actually increase your risk of getting a first heart attack by as much as 50%. And then, you know, similarly, on the other side, there are more and more studies showing us that the healthy living risk factors, protective factors like physical activity, actually is also protective of mental health and cognitive health, and not just of physical health. So these 3 core risk factors of healthy eating, physical activity, and social connection and social supports actually are protective factors for both our common mental health issues and our most common chronic disease issues. So here are some evidence in terms of what we can do for evidence-based solutions. So in the US, there's a task force called the US Task Force on Community Preventive Services. You don't know of it, I highly encourage you to check it out at the website that you see, thecommunityguide.org. And then you can go to topics, and there's different topic areas, including physical activity, nutrition, obesity, diabetes. Take a look at those. And there's actually, so this task force reviews the evidence annually. They've got a list of topics. They've been doing this for many, many years. And they then do systematic reviews and come up with a list of recommended interventions based on sufficient levels of evidence from their systematic reviews. Now, more recent topics may not have been reviewed yet. However, there are many topics that have been reviewed by them, and they include, for example, community design. Community design, having enough density, at least in certain areas, where you can have residential areas close to stores, to jobs, to schools, and to rec areas, connecting them with sidewalks and good connected streets, ensuring that the streets are safe and have aesthetic appeal for pedestrians, as examples. You can shape those by zoning, building codes, government policies, building practices. The impacts have been shown to be associations with over 160% median improvement in physical activity, but also increasing a sense of community and decreasing isolation and reductions in crime and stress. So when people are out and about walking around in their community, they more often run into their neighbors. and get to know them. There are more eyes on the street, which can also help to improve feelings of safety related to, for example, crime. Building design is another area that can complement community design. So simple things like putting signage outside of stairwells and at elevator call buttons that remind people in their busy lives to take the stairs, as an example, for people who are able to. Those simple signs placed at points of decision have been shown to increase stair use by over 50%. In higher rise buildings, there are opportunities to reprogram elevators to stop at every third or fourth floor rather than every floor, except for the one elevator that is meant to service everyone, including those with disabilities. And those types of buildings have been studied and have shown a 3,300% increase in stair use. Design and aesthetic interventions, so making, instead of putting music and art into your elevators, you put the music and art into your stairwells. Improving visibility and convenience of finding the stairs have been shown to be effective, and natural lighting. Food environments are another area that are important. Again, the community guide has reviewed the evidence, and they found that community gardening interventions to be particularly effective in increasing fruit and vegetable consumption amongst children. So school-based gardening is particularly important. There are other studies that seem to show that adults benefit as well. And then the types of food retail that you have in the community really does seem to matter as well. So having healthy food available through things like supermarkets is associated with lower rates of neighborhood obesity. And then conversely, having a high density of unhealthy food outlets like fast food restaurants is associated with increased weight and obesity and unhealthy eating in both adults and children. All right, so based on work like this or evidence like this, there have been multiple jurisdictions that have been involved in undertaking improvements. So for example, when I was in the US, we worked on several documents, but one document was this active design, affordable designs for affordable housing that tried to improve housing in New York City, Atlanta, and San Antonio. And so you could see they are different sized municipalities involved. So we worked with both private sector developers and with the municipalities and their housing authorities. And we're looking for, affordable, simple ways that could improve these affordable housing developments. And affordable housing is particularly important because many low-income neighborhoods experience barriers to healthy food access and to physical activity. Often they are food deserts and don't have supermarkets. And they're also food swamps, and they're filled with, unhealthy food outlets like convenience stores and fast food outlets in place of grocery stores. So simple things that included, ensuring that there was gardening opportunities for both physical activity, social connections, and healthy food access. Improving the stairwells and encouraging stairwell use through stair prompting signage. You could see in the Region of Peel document for healthier, affordable housing standards, ensuring that there's things like bike parking. In New York City, there was also an introduction of bike share stations outside of social housing properties, and then coupling that with a reduced cost of membership for joining bike share. So there are these different things that can be done. And there are many also elements that don't have to be expensive, and they include shifting costs from sedentary to active design elements. So you could see in the cover of that active design, affordable designs for affordable housing document, that is a real project in the South Bronx in New York City. It is a low-income housing project. And you could see that instead of having just a outdoor space that would have had just nothing, the outdoor space was re-landscaped by the developer to include outdoor exercise equipment and play equipment for children. And they turned the outdoor area into a sort of a little exercise circuit for the community to use. These don't necessarily have to be more expensive. And in fact, you know, like for example, buying lawn and landscaping elements and benches can cost money as well. And shifting to active design elements like exercise equipment outdoors, play equipment for kids, don't necessarily have to cost more. Thinking about where you locate developments is very important. So locating in more walkable, mixed use and complete communities. Co-locating healthy amenities for community use on site. So if it's a community that is lacking in grocery stores, if it's lacking in you know, play space and park space, can those be integrated right into the housing development site for use by both community residents as well as building residents? And then the idea of encouraging mixed income developments that include both affordable and market rate units. Here's another example of what's been done. This is in Ontario in St. Thomas. St. Thomas has a population of about 38,000. You can see that they had this old railway park, a railway bridge that was no longer in use. And this is actually modeled after the High Line in New York City. So, you know, New York City, about 9 million people, St. Thomas, about 38,000. And both have redeveloped their old elevated railway line that was no longer in use into an elevated park with arts elements, with, you know, various, you know, activity elements. It's a walking park. These parks are often developed with, you know, monies that are raised through volunteer efforts, community donations, foundations, etc. So it's an additional idea for public amenities that can be created. Anyways, based on these previous successes, I was invited by the Public Health Agency of Canada to submit a grant to them. And I'm happy to report that they started funding this in 2018. And so University of Alberta was recipient of this grant called Housing for Health. And Housing for Health, we've originally we started with about 15 to 20 partners, and happy to report that it's grown currently to over 200 partners, not just in Alberta, although many of the partners are in Alberta, but BC, Saskatchewan, Manitoba, Ontario, and Quebec. We are partnering to improve housing in the neighborhoods around housing, physical activity, healthy eating, and social connections. We're working together actually on creating a set of healthy community guidelines, including we have currently a smaller and more rural communities working group within the larger Healthy Community Guidelines Subcommittee. So if you're interested into that, please contact Shanique and I after this presentation. We can tell you more about it. It's also on the website where we've provided a web link to our Housing for Health project. We also do community engagement, including workshops with community residents, and we partner with either municipalities or folks already working with community residents, like community groups. And so if you guys are interested, do let us know. There are opportunities, I'll tell you about that in the next two slides. We have 3 pilot developments where we're trying to improve these developments, both affordable housing and market rate housing, with developers and the municipalities, and that includes Whitecourt with a population of about 10,000, Leduc, population about 13,000, and Edmonton, population about 1 million, all in Alberta. We're evaluating health and well-being impacts when you move into these developments, and also through the community engagement work that we're doing. And we have an annual Fit Cities, Fit Towns conference. The next one is actually going to probably be 2 half days, March 1st and 2nd in the morning, or 2nd and 3rd in the morning. Hopefully you could mark your calendars, and some or all of you can make it. The conference, because it's supported by it'll be a virtual conference again this year. And because it's supported by the grant currently, the cost should be pretty minimal. I think last year it was like $10 early bird and $20 for if you were post early bird. So the Healthy Community Guidelines are trying to improve physical activity, access to healthy foods and beverages, and social connections through how we design our neighborhoods, streets, buildings, and sites. And it's targeting, community groups, developers, home builders, planners, municipal officials, and health folks as well. If you want to be involved in this or in reviewing the final drafts before they come out and giving your input, please connect with us. And community engagement, we've got this process where we do 2 workshops. The first one is a general learn about community environments and health and brainstorm ideas. Then at the end of that workshop, community residents actually will, and we work with community groups already working with community residents. And so people will vote at the end of the workshop, and then the top ideas, there'll be a few top ideas, then the community group we're working with will identify one of the top ideas that they want to build out further. We usually do a second workshop around it, and then we actually try to do an intervention. And so our grant can actually pay for temporary interventions. For example, if it's determined that there's a vacant lot that could be turned into a community play space, we could rent a bouncy castle or even buy a bouncy castle to be used, over, let's say, one summer. And you could see if that works well. And then before you invest to make that space permanently a new park, as an example. Community gardening equipment. So temporary gardening boxes are eligible, even temporary outdoor exercise equipment. But that has to be shared equipment, so like mounted on, let's say, a platform and can be moved to different communities. Hopefully some of you might be interested in working with us in your communities to mount some of these workshops and to do a community prototype. Let us know. Anyways, we want to thank our funder, the Public Health Agency of Canada, but at the same time, these don't necessarily represent their views. And then just some websites where you can garner more resources. Just as a heads up, some of the work done in the United States and in other parts of the world, including, Peel and other parts of Canada. If you're interested, I was asked to write this book, Fit Cities, and documents actually some of the successes of that have been done globally, actually. So thank you very much, and I'm looking forward to hearing Bonnie's thoughts and her initiatives.
Thank you so much, Dr. Lee. So I will share my screen again. And we can get started with Bonnie.
Can you hear me?
Yep, we can.
Yeah, good, okay. All right, well, thank you, Dr. Lee. I see many things that we are doing within our community that fall in line with what you're talking about. Healthy eating, physical activity, and social connections have been really something that we have pushed to the forefront in our community to make it a better place to live. We are a community of 1,800 people, and we have a lot going on. We have great champions within our community, and I'll tell you, the road to our success is based on the principle that communities have the power to determine their own solutions to healthy communities, to create healthy community environments. Community members that support the development of initiatives that address a wide range of healthy areas or concerns across our community are gathered together, and they look at focusing on changing the community instead of just the single person's time that they want to be out in the community. We're looking at the community as a whole. Our road to our success, we developed an action plan, and we created places where we could have a healthy community that is engaged in activity and in healthy eating and in social connection. So we did a lot of that during the last few years. Vulcan's journey started with the gathering of the Acts for Health group, which was part of the, what's it called? the ACPLF. So we got a grant that helped, it's basically the cancer prevention. And that helped us really, it was a catalyst to moving a bunch of things forward and then just changing the way we looked at the community. So with that group, we gathered 5 different areas within the community. Usually we work as silos and we work with, you know, the kinsmen or the school, but never everybody together. And this, under this Acts for Health Committee, we looked at the community as a whole. So we had community at large members. So that would be community leaders, volunteers, people from the town, the county, the Health and Wellness Foundation that we have. Then we looked for the community facilities and organizations that we had to use. So community services manager, myself, the town, the county, early childhood development people, our recreation coordinator, the Vulcan County Family and Community Support Services, our community liaison, our food bank managers, executive directors of the Rainbow Literacy, and on, the public library, etc. Then we looked for the healthcare people to come and be part of it. So we had the Calgary Rural Primary Care Network's chronic disease nurse be part of it, AHS Community Development Coordinator, AHS Public Health Dietitian, AHS Clinical Dietitian. And then we look for workplaces, so nurse managers, hospitals, Vulcan Hospital people, Chief Administration Officer of the Peter Dawson Lodge, in the town of Vulcan, County Vulcan. And then we look for the schools, so the principals of both, we have 2 schools in town. So we gathered all those people together and we decided that we needed to make a difference for our community, for not only our individual self, but the community at large. And so there's quite a few initiatives that came out of that. We did, as you can see on the slide, there was a want to create snowshoeing and cross-country skiing. We haven't had that in our community, and we know Southern Alberta, we're not always guaranteed snow, so there has never been an investment in trying to create something like that. But we had talked with a lot of individuals, as you see around the table, and that was something that people were interested in, to help create the connections, because you can do that with family, friends, or do it solo. The healthy living part of it, being out and active, which is always great. So we, as a committee, we decided that we would go and approach the golf course once again, because that has the nicest area in town, and ask them about partnering with us to be able to use their facility on the off season to create this cross-country and snowshoeing. And they graciously allowed us to. We've been working hand in hand. Their main concern, which was great, they didn't want us on the green. So we worked with them and mapped out an area to make sure that nobody would go on the greens. This did take a change within the golf committee itself, because they had been approached before and were not interested in having other people other than their members on the course. But because there was a change in their association, we went back to them and asked them. This association was more than happy to be part of the community in a year-round way. With the cross-country skiing and snowshoeing, we knew that, you know, snowshoes would probably be something that not everybody has. And it doesn't, you can use them without having a whole lot of technical experience. And so we decided as a group that we would purchase several pairs, different sizes, and put them in our library. And we asked the librarian who was on the committee if this would be something that she could broach with her organization. And they were more than happy to. So now you can loan out snowshoes from our library and be active all year round. So we're trying to eliminate the financial barriers, the equipment barriers that people have. Where the snowshoe and cross-country ski trail is within the golf course, it's right off the parking lot. So people that have some mobility issues wouldn't have to worry too much about, you know, having to navigate their way through somewhere else. They can just hop out of their car and start going. The other initiative is, and Dr. Lee talked about this too, is healthy eating. And we wanted to talk with our local grocery store and see if they would be part of this, so we could help people recognize what healthy eating is. Sometimes we just take it for granted. People know what things are healthy and what aren't. And so we decided to put little markers, and you can see them on the left-hand side of your slide there. We had them put up in the grocery store beside all the things that are healthy. So like oats are healthy. So there was a little thing that said, this is healthy food, and gave a little thing about it. And then it said, when you purchase this, some money will go back to the food bank. And so the store kept track, and there was about 200 items within the store. And they, every time when those items were purchased, it not only gave a family some healthy food to eat, but it also provided people that are in financial straits and aren't able to provide that kind of food, to be able to have some money going back into the food bank. So it just kind of did a whole circle with everybody that everybody could enjoy. Okay, you can go to the next slide. Do we have another? So, so that the initiative for the cancer prevention with AHS ended quite a few years ago, and this committee is still going strong. We have been out in the community and trying to reach out, and other organizations that don't sit around the table regularly decided that they wanted to be part of creating a healthy community. And especially during the lockdown, the couple of different clubs in the community have come forward to ask to do stuff. So in the background of the first picture, you can see just barely the exercise equipment that was placed in there by the Kinet group. And well, one group can't be outdone by another. So the local Lions Club, Lions, they decided that they were going to do a really unique park to get people out and active and be back outside in a comfortable manner for them. So we created, together with the town and lots of organizations, created this Kinsman Backyard Games Park. And I think it's probably the first backyard games in all of Canada kind of park. So there's not only washers and toss, ladder golf, but there's places for families to come. There's usually picnic tables beside where you see the fire pits and stuff. But these have created areas for people to come out and be active and engaged all year round in a way that is comfortable for them. So right now, some people feel really good about just going out and being active, and some people are still very leery about being out socially within the community. And these are things that they can do. And the Frisbee golf, you can come and loan out the different kind of Frisbees here at the rec office. And all the games, game equipment for the backyard games is loanable from the library. Again, another partnership that we kept going. We just heard from the another organization that, seeing what other community groups are doing, wants to add on to our exercise park and do some other things, possibly a ninja park, to get all age groups out and active. So it's so important to get people out and active and engaged in your community, because not only do you have a healthier community, but you have a happier community, and people see that and want to be part of it and want to stay in your community. You know, we're an hour from Lethbridge and an hour from Calgary. And so we're somewhat isolated on Highway 23. And, you know, our community grows very slowly, but when people come here, they stay. Yeah. And I think one other part, so these parks, one of the things that the town has done and invested our time in is helping these organizations out. So providing, we gave them 5 spots that they could choose to do different, do the Frisbee golf. We showed them that we are more than willing to help do the cement, so we made sure that we were good partners and listened to what they wanted. We went back to council. They asked if they could have some money. We went and looked for different grants for them. We were successful in some of our grants, and the payoff for them is being recognized not only in their community but also by the Choose Well community. So yeah.
Thank you, Bonnie. That is so inspiring, and I just think it's such a testament to how you can utilize different places and spaces in your community to really activate healthy living. And so thank you so much for sharing. Let's get into our discussion now that we've heard a little bit from our champion and our expert and how you guys are involved in creating healthy places. So yeah, let's get started on our roundtable discussion. Again, everyone watching, feel free to drop any questions you may have. So I'll start with this. Bonnie, after seeing Dr. Lee's presentation, do you have any thoughts or questions about future endeavors that you're working on in your community?
Yeah, so I love Dr. Lee's presentation. It shows us that we're on the right track. And, no matter what size of your community, you can pull together. You don't have to wait. You can be the person, you can be the catalyst that makes the difference in the community. And it sounds like Dr. Lee has a lot of resources. And I look forward to contacting her. One thing that kind of struck home with me with what she said, and maybe it's just a little thing, but it's the sidewalks, making sure that sidewalks lead somewhere. And my husband and I are very avid walkers around town, and I've noticed that there are sidewalks that don't lead to places. And me having no mobility issues, easy. But people with mobility issues, we want to make sure that they feel included. So those places where the sidewalk ends, that book, I always think about that book where the sidewalk ends. So I'm going to be looking at that as community manager and approaching the town to really look at that. And also those, taking advantage of what Dr. Lee has talked about, and looking for opportunities where we can think outside the box and maybe, do a pop-up something and see if it works. Just try. If it doesn't work, such is life. And people go, well, you should try that. And now we've moved on to something, and it brings you closer to the success that you're going to have. So, yeah.
And Bonnie, the other thing is the sidewalk clearing in winter time, right? Particularly for those who might be older or who might have, some disabilities. Like the clearing of the sidewalk is absolutely important for its use.
So true.
Yeah.
Yeah.
Okay, and would any of you like to share some more experiences that have maybe cultivated any growth around places in your community? Speaking on that.
Well, I think having, like I said, that Acts for Health, the AHS Cancer Prevention, they gave us seed money, which is always a great catalyst for any community to start doing things. But it changed the way that I look at people. Like I said, I don't look at groups and people as silos anymore. I look at them as the beginning of something great. And we're not stopping. We have so many things. We just finished a brand new pool, but that was a catalyst from the Lions Club, who are in partnership since the beginning of time, since we've had a pool here. So we've just built a $5.4 million pool in a population of 1,800 people. So, that, and they were able to raise just about $1 million within the community to go towards that. And, the Canettes want to do something, the Lionettes want to do something, and just bringing everybody around the table. And I think the biggest thing is to stop and listen to what they are saying. Sometimes we have a tendency to go, yeah, we talk about that and we can't do it. I think we need to stop and listen to the community leaders and go, okay, tell me your whole vision. What do you see? I haven't looked at it that way, so let me see what else is going on in within your club or your organization or your group, and it might spur something that just sparks something, and you can move forward on that. And the changes, whenever you do something in a community that gets people out and active, and you might be a contributor to their healthy living, it's amazing.
And I noticed, so speaking on like collaboration, and you kind of outlined how you started with decision makers, or reaching out to different people in your community. I don't know, Dr. Lee, do you have any suggestions when approaching like decision makers on topics like this to build healthy communities, or any thoughts on that?
I think, like Bonnie, I think a really key piece is learning to work outside of our silos. And so, when I was in New York, one of the early things that we did was actually bring folks together through a Fit City conference that became annual. And so we invited not only folks from health, but folks from planning and transport and parks and rec, and even private sector folks like developers, urban planning firms, architecture firms, to come together, and nonprofit organizations who work in these areas as well, like sustainability nonprofits, nonprofits who were working on community development, to come together to brainstorm together what we could do. The other piece is the community engagement piece. So often when we had the conference, a lot of people who came, because it was during the workday, were folks who worked professionally in these different areas. That was really great for getting ideas from these different professional groups on what they felt could be feasible in their areas and in their fields to do. And so I think if you're And what's really important as well is between those conferences is actually for the ideas that get brainstormed, you want to actually be able to be set up to actually run with them. Like, for example, to form a working group that could develop one of the top ideas, right? The other piece is the community engagement piece. And so the community engagement piece is actually, as Bonnie said, bringing together community residents and potentially community leaders who actually can brainstorm together what they would like to see. And after brainstorming that, we'd like to see actually some of it trialed out, even if it's on a temporary basis for now. So I know that, resources are always scarce, etc. I wanted to highlight that currently in our grant, we do have, for this current fiscal year ending March 31st, 2022, for our community engagement work, we do have some accruals that we need to spend down by March 31st, meaning we have to buy, purchase, like if we want to buy like equipment, for example, for communities to use, we have to buy them, it has to be delivered, and we have to pay for it by March 31st. But we, Shanique and I recently had a meeting with different community groups in Edmonton who might want to jointly purchase some shared equipment that could move from neighborhood to neighborhood. Now, if there are communities here outside of Edmonton, right, represented here, who want to see some of this in their communities as well, Shanique and I can set up a meeting for us to talk about that. And maybe communities that are not too far from each other, like Bonnie, if you're an hour from Lethbridge or an hour from Calgary, maybe there's some equipment that could be shared even between Lethbridge and Vulcan, that could move between communities there. Because we can't buy permanent infrastructure because it's a health grant, but they will allow us to buy like temporary equipment that could be shared in different neighborhoods of a community or in different communities. So this might be an opportunity. And then what we would do is work with you as well to undertake some community resident engagement workshops that could brainstorm how to use this equipment, like where it could be placed temporarily for use. And if there's a variety of equipment, it could even be which piece of equipment do they want to trial out in which neighborhoods, that sort of thing. So I just wanted to encourage folks to think about that. If you're interested, contact Shanique and I after at the H4HU Alberta email. Yeah, so I would say the not working in silos, and just as Bonnie said, and both professionally and also working closely with community residents and leaders.
Great. So kind of the idea that when we're looking at who should be at the table with these discussions and brainstorming, it's kind of everybody should be involved to really kind of have the biggest impact is kind of what I'm hearing.
Yeah, and you know what? If you invite a whole bunch of people and not all of them show up, that's okay, because you can still get started with the ones who do show up and are most interested. And if you do it well with the ones who do show up and are most interested, like the early adopters, and you do it well, the success will be shown to others, and then more people will hop on along the way. So I think the idea is, you know, to have these multi-sector partnerships, to have the partnerships with community residents, and to get started with those who are interested and willing to get started on, and then you can grow it over time.
I love this because exactly what you're saying, Dr. Lee, is what Bonnie has done in practice. So it's like, here's the evidence and here's, you know, evidence-based from you, the expert. And then we also have a community who has implemented that and had great success. So that is really amazing. Since
Can I add one thing?
Yeah.
I think it's so important that you know, we make these community connections. The hard part is making sure they don't dry up.
Mm-hmm.
So we need to keep, even if that thing is taken care of and it's done and everybody celebrated and everything, keeping those connections, reaching out and saying, hey, have you thought of something else? Or I have this piece of land I'd like to use, you know, don't let those wonderful things that you've created dry up. Always work on them. Be vigilant about them. Reach out every once in a while. Make sure that you're connecting.
Yeah, and I was also going to say, there was a quote, I can't remember who said this quote, but the quote was, don't let what you cannot do get in the way of what you can do. And so always get started, and the small wins count a lot. You don't have to immediately change like some major policy in order to say, oh, I have a win. You can start making those changes, even if they are.
I have a thing that I keep on my wall. It says, ask the question, not what is wrong, but what is strong with your community.
Mm-hmm.
And I keep that so that, because sometimes, especially during this last little bit, people that have been running arenas or pools or any public facilities has been really I don't know, people have not been very nice, to put it easy. And so we can just look at the negative of it and just say, you know, the community's a bunch of bags, so we're not gonna, sometimes we call them that Real Housewives or whatever, but we need to make sure that we're not looking at what's wrong with our community, what's strong within our community. And the people are strong, and the ideas and the thoughts that they have can be wonderful. Make a place where you live and work a great place to be.
Yeah, and I'm definitely hearing like a very strength-based community approach with what you're both saying. Focus on the strengths of the community, right? So just to wrap up, I want to ask you both a very quick question because we are a little over time. If you can answer this one in a shortly, it's kind of a hard one though, but what is an example of a quick win that a community can do to move the needle in regards to creating healthy spaces? So what's your best advice to wrap up that a community can do to just kind of move the needle forward in creating healthy community spaces?
Well, if you get invited to attend a committee or an organization's meeting, go. Make those meetings, make those connections, and just look for ways to keep active. Get out from behind your desk or off your phone and get talking to people personally. And they'll lead you to those things, right?
Yeah, and I would say, like, look at what you can do. So for example, your own organization that you work for, are there things that you guys can get started with doing already that could start to improve your own, for example, worksite environment for your staff? Or, you know, in your own work serving the community, what can you already do to integrate one of these items, like healthy living related to physical activity or healthy food access, right into that work to get started? And then, of course, starting to engage, to think about and engage different partners.
Okay, thank you for that. So since we are a little bit past time, I will wrap up, even though I would love to stay chatting with you both for longer. So just in regards to contacting us, you can contact myself, Alicia, I believe Dr. Karen Lee and Shanique both dropped their emails in the chat box. So there's a bunch of information in the chat box. The email is h4h@ualberta.ca. And so you can contact that email if you are interested in doing that equipment sharing that Dr. Lee was talking about. And Bonnie just dropped her email in there as well. So if you have any questions or comments, I'm sure you can send them to Bonnie as well. And our recording will be shared on our website. And so you can feel free to share those with your networks as well if you want to share those around. And lastly, I want to thank everybody for attending, and thank you, Dr. Karen Lee, Shanique, and Bonnie for coming and being part of this, sharing, and yeah.